Hello, friends. So today is World Sepsis Day. So on this day, it's very important and imperative that we discuss the theme for 2025 World Sepsis Day. And in fact, we take good pride in releasing the special postal cover on this particular day. And globally, it's the second postally commemorated cover that we have released. It's a very epoch moment for us. So it is important that all the intensive care community come together, join the hands to campaign and raise the awareness on this World Sepsis Day. So I have my beautiful team here sitting who are all cheering here for the World Sepsis Day. So we'll talk about what is the theme and what is the essence of this particular theme. The theme for 2025 is five facts and five actions. So I'll just try to encapsulate this in one slide and then try to detail on the World Sepsis Day. So the five facts is we need to understand the magnitude of the problem that sepsis is plaguing the globe every 3 seconds. So as I'm speaking, there is one patient dying across the globe. So every 3 seconds, one dies. And the second fact is we all need to be available that the most vulnerable population are the ones who get more affected. When I say most vulnerable, it is elderly people, it is children, it is someone who is immuno-challenged or immunocompromised, or someone with chronic diseases, someone with malignancy. So these are the people where special attention has to be paid and identified early on so that the morbidity and mortality could be prevented. And the third important fact that we need to be aware is most deaths are preventable provided we know what is sepsis, we are aware of what is sepsis, and necessary steps are taken to prevent deaths. And the fourth important fact, which is important from the societal standpoint, is not many countries have looked at it as a problem statement, and not many countries have invested into it as a problem, and not many countries have funded the measures that needs to be undertaken to avert the deaths due to sepsis. And the fifth fact is stronger campaign, sepsis campaign, and awareness and protocolized management of sepsis across the healthcare organization is something that is essential. So these are the five facts that are elucidated as a theme for 2025. What are the five actions? So five actions is every country has to prioritize like now, like if we take, say, our own country, India, so maybe we have prioritized diabetes, maybe we have prioritized heart diseases, but we have to understand sepsis is a leading killer compared to coronary artery disease or strokes. If you look at the deaths due to sepsis are more than the coronary artery disease and the stroke. So we need to prioritize this, and countries need to fund a campaign and in mitigating this sepsis. And the second action is have a protocol in place. So nationwide protocol has to be put in place to curb this menace of sepsis and prioritize. And all the global authorities should come forward and prioritize the funding for this sepsis. And one has to use digital media in raising awareness. So audiovisual media, print media, influencers, communicators, and academicians like me have to campaign to curb this menace of sepsis and prioritize sepsis in the emergency response. So when we say emergency response, there is a conflict happening in Palestine or in the Ukraine or in the global pandemic like COVID. Sepsis becomes an important cause of deaths during these natural disasters. It may be floods, it may be tsunami. And sepsis is one of the common killer as a secondary problem. So we need to prioritize this during the emergency. So these are the this is the sort of a essence that has come out of as a theme for 2025. So we'll just try to extrapolate to understand the problem statement. So we'll talk about fact one. So every 3 seconds, one patient dies. And if you look at the magnitude of this problem, 4.89 crores people. So I'm talking crores because in India we call it as crores, or 48.9 million people per year die of sepsis globally. So 4.89 crores is just about population of Karnataka. It's around 6 crores if we take, or nearly that are dying every year. And 1.1 crore deaths happen per year. So 11 million deaths happen. So sorry, the first one is 4.89 crores get affected by sepsis. 1.1 CR die every year because of sepsis. And very important for intensive care community, in 11 million deaths, 4 million deaths happen in ICUs due to antimicrobial resistance. So this is a very important problem statement that has come out in this 2025, that AMR, antimicrobial resistance, is a problem. It leads to 4 million deaths, 40 lakh deaths happen across the globe. So that's about the first fact extrapolation. The second fact is 85% of the global burden of sepsis remains in lower middle income countries, especially in Africa, Asia, and Latin America. So this is a problem for India. So it is our countries which tend to get more affected. And hospital mortality, one of the leading cause for hospital mortality is sepsis. So this is also something we need to do. And the second fact is it affects most vulnerable. As I said, elderly people, immunocompromised, and females seem to be affected more in sepsis, is what has been referenced. And poverty and areas where there is limited access to the health care, these are the people who are most vulnerable. When we say vulnerable, elderly, females, immunocompromised with whatever conditions, and poverty. I think the lower socioeconomic status and geographical areas which have poor access to the healthcare, they have problem and they are more vulnerable to get affected by sepsis. And even the morbidity and mortality in these patients tend to be a lot more severe. And the third aspect is the preventative measures. They should be focused on certain immunization and vaccination against certain diseases. Like obviously elderly people, they need to be vaccinated with flu vaccine, because when they have flu, secondary infection and sepsis happen. In COVID, 75% of them were found to have sepsis, especially were admitted in ICU. So vaccination and pneumococcal vaccination. So these vaccinations or investment into newer vaccines to avoid certain diseases has to be put in place, and very good infection control measures and early detection of sepsis. So all these are important facts that one needs to be aware. And we are all aware why early detection is important. If we do not recognize sepsis, every hour delay increases the odds of them dying by 7%. And many studies have pointed out that every hour delay in identifying sepsis and taking necessary measures increases the risk of death by 7%. So the fact four is the countries. As I said, only 15% of the countries have invested into sepsis policies and action plan, and less than 10% countries have nationwide protocols. So maybe we should work more on this, and we should have a very uniform protocol as a nationwide policy that every place should incorporate while dealing with sepsis. And if you look at the stats of the amount spent for every patients who get affected with sepsis in Europe, the cost per patient is 36,000 euros. So that's quite a bit. And it constitutes 3.65% of the health sector budget. And in US, if you look at the amount of money spent for sepsis per year is $62 billion per year. And for readmissions, $3.5 billion are spent. So friends, I need to just take a pause here. In US, there is $62 billion per year spent on patients admitted to sepsis. So would you have any idea what is the Indian healthcare budget from the government per year? Per year. Yeah, it is about $10 billion. So we are really looking at the proportion and magnitude of the burden this sepsis can cause. And in Germany, they have looked at admissions due to sepsis per year is 320,000 patients per year, nationwide admissions, out of which 27% of them have hospital mortality. So 320,000 get admitted every year because of sepsis in Germany, and 27% is the mortality. And they have looked at 3-year cost in Germany, it was 6.8 billion per year. As I said, in India, it is around 10 billion is the healthcare budget from the government for the healthcare. So these are the staggering sort of statistics that we should bear in mind, the type of burden sepsis has on the finance as well. And the fifth fact is sepsis has to be considered as a proxy indicator of the national health system performance, and it should come under the umbrella of universal health coverage. So this is something that we should advocate, that sepsis should be formed part of the universal health coverage. And there should be an emphasis on prevention, early detection, and treatment. And these indicators should be a marker of well-functioning health systems. Like now, in India, the well-functioning health system we call when infant mortality is low, maternal mortality is low. Maybe perhaps we should get sepsis mortality being low as one of the indicators of national health. I think that is what one should advocate. Societies like us should advocate for this. And in pandemic, preparedness towards tackling the menace of sepsis has to be put in place because 78% of the COVID patients who were hospitalized had sepsis, which is again a staggering figure. So if you have a flu outbreak, very likely the statistics of them having secondary sepsis will be very high. And we need to have this sort of a sensitization to this as a problem and necessary measures put in place to curb this menace. So now that's about the detailing of the facts. And what about the actions? Every country should fund a national sepsis policy and should have action plan and universal health coverage. Sepsis should be integrated in the universal health coverage, like vaccine coverage and like the diabetes policy or measures to curb the infant mortality. So sepsis also should be integrated in the universal health coverage. And the government should seek support from the World Bank, the Global Fund, and Gavi. Gavi is Global Alliance against Alliance of Vaccination and Immunization. So government should seek support, seek funding, and have a separate fund allocated for curbing the sepsis. And the second action is every country should invest on having their nationwide sepsis protocol, regular training programs like how I'm doing. Nation should do it at every level to train all the healthcare personnel who are dealing with the patient and have national guidelines for curbing this sepsis. And one should advocate, every hospital should advocate 1 hour sepsis bundle in the ER or at the hospital level for the children and for the elderly patients. So there should be 1 hour bundle which has to be campaigned for and has to be an SOP that needs to be ingrained into the functioning of every healthcare industry. And sepsis should be part of the nursing protocols and doctors' curriculum. So their curriculum, nursing curriculum and doctors' curriculum should have 1 hour sepsis bundle. So the third action is global health actors like United Nations or WHO should prioritize and fund for the sepsis. And these global health actors should invest into new vaccines, should invest into diagnostics like rapid diagnostics like polymerase chain reaction or multiplex PCRs. Diagnostics, one has to invest so that we identify the sepsis very early on and necessary measures are taken. AI tools have to be incorporated and there should be investment into newer antibiotics and investment into immunomodulation, precision medicine. When we say precision, maybe biomarkers, immunomodulation, so on and so forth. So the global health actors should invest in these domains or dimensions so that we minimize the impact of sepsis. The fourth action, so the media has to be involved. So this is very important. It's not the cardiovascular disease which kills more people. It is not the strokes that kill more people, but it is the sepsis. And the media has to be made aware that it is the sepsis that kills more people than the cardiac disease or the strokes. And it has to come in the print media. Journalists has to be involved. Influencers, communicators, and academicians like me have to be involved to campaign to mitigate this menace of sepsis. And fifth is prioritize sepsis as a part of a pandemic. When there is a pandemic or natural disasters or the conflict, so there has to be preparedness plan, pandemic preparedness plan, whatever plan is there, sepsis should be integrated into the universal health coverage and sepsis should be integrated into pandemic preparedness plan and necessary measures to be put in place to curb. And all the natural disasters or the war areas, sepsis has to be looked at as one of the killers and necessary measures to be taken. So this is a brief about 5 actions and 5 facts. So these are the 5 facts and 5 actions that I wished to elaborate. Then we need to dwell. So there's so much talk on sepsis. So who are the historians? Because today is a special day where we are commemorating a special postal cover. So we need to talk historically how sepsis is evolved. So this is a gentleman. The whole concept, it's been around. So if you look at this gentleman, so 1818 to 1865. So there are more than 150 years has passed, how the sepsis is evolved. So it is Ignaz Semmelweis. So this is a stamp issued by Austria in 1965 to commemorate death centenary of Ignaz Semmelweis. And he's the first guy in 1847. So close to 150 years back, many patients were dying because of puerperal sepsis. After they deliver, they used to die. No one knew why they were dying. And that is when this gentleman, Ignaz, I would call him as a father of sepsis, because he is the guy who said that these deaths are happening because of contagious sort of hands which are transmitting contagion and patients are dying. And he advocated hand washing. And he's the pioneer of hand washing. Even today, hand washing is the simplest sort of a measure that one can undertake to curb and prevent sepsis. And he, at that point of time, advocated chlorinated lime for washing the hands, which showed mortality reduction from 12.24% to 2.38% in puerperal sepsis. And the puerperal sepsis was called as cot death at that point because many mothers used to deliver and die on the cot. So it was called cot death, and which is beautifully depicted on this West Germany stamp, 1956. The stamp, so you can see this lady on the cot who she has died. So nicely stamps depict the historical tidbits of this. And he published this in 1861. Ignaz Semmelweis published these findings that puerperal deaths can be prevented by effective hand washing with chlorinated lime. In this particular book, Prophylaxis can beggars, etiology der Begriff. So this was the one which was authored by Ignaz Semmelweis. Unfortunately, he died in asylum, possibly because of Alzheimer's and senile dementia. So this is how it started. And after that, this gentleman, Louis Pasteur, came in 19. So the stamp is issued by Wallis and Futuna Islands in 1995 to commemorate 100th death anniversary of Louis Pasteur. So what it? So I'm taking through the historical tidbits in a chronological order. So where Ignaz Semmelweis said contagiosity is what caused the problem, but it was Pasteur at that point of time. No one knew that it was the microorganisms that are causing the disease. And Pasteur, Louis Pasteur, in 1857 to 1860 came out with a hypothesis or the fact that microbes or the microorganisms are the ones that cause the disease. And that became the scientific basis for the infection control and antisepsis policy or antiseptic. The word antiseptic as a philosophy in curbing the menace of sepsis arises from Louis Pasteur when he said it is microorganisms that cause the disease and the subsequent sequelae of it. And this was a stamp issued by France. He was a French guy in 1938. And Louis Pasteur also was instrumental in developing vaccine against rabies and against anthrax. And all this laid the foundation of hygiene because hygiene was not an entity at that point of time. And it laid the foundation for surgical antisepsis and significantly reduced sepsis mortality when this finding was established that it was the microbes which caused the disease. And this was a stamp issued in 1965 to commemorate Lister. So the centenary of Joseph Lister. So Joseph Lister was a pioneer in antiseptic techniques, and it was the Joseph Lister who brought out with phenol as an agent which can used for antisepsis. It was called carbolic acid. So phenol was used to disinfect or sterilize surgical instruments. This was advocated by Joseph Lister because at that point of time, every surgery was fraught with increased mortality. That was minimized or mitigated or significantly reduced when Joseph Lister pointed out the use of phenol or carbolic acid to sterilize the surgical instruments and to sterilize the surgical wounds and as a sterilizing mechanism or as an agent to sterilize the operating environment also. So OT. So this was also very important contribution to the surgical sepsis because he took measures to curb the post-operative infections or surgical infections and significantly reduced mortality due to sepsis. Now, this was the earliest equipment that Lister used to deliver phenol for disinfecting the instruments. And this is Robert Koch. So this was a stamp issued by India in 1982 to commemorate the centenary of discovery of tuberculous bacilli. So Pasteur said microbes cause diseases, but it was Robert Koch who said specific microbes causes specific diseases. And he was instrumental in discovery of Mycobacterium tuberculosis Bacillus anthrax, and Vibrio cholera. And this was a stamp issued by East Germany in 1982, again to commemorate centenary of discovery. And he also postulated Koch's postulate, which was a systematic study of pathogens. And until then, sepsis was considered as a mysterious fatal conditions, and that was changed to a disease sort of a situation or disease sort of a condition by Robert Koch, who advocated measures to prevent and treat this disease rather than a mysterious fatal condition. So that was the Koch's contribution. And this was a stamp issued by Faroe Islands in 1983 to commemorate Sir Alexander Fleming. The whole concept of sepsis was revolutionized, and a lot of lives were saved by discovery of penicillin by Alexander Fleming in 1928, where this Penicillium notatum was the fungus which was found to inhibit the bacterial growth, and penicillin was derived from this. But that was Alexander Fleming discovered penicillin in 1928, but the mass production of penicillin, this is Howard Florey, he's an Australian, he's from Adelaide, and he's from the University of Adelaide, where I happened to have worked in Royal Adelaide Hospital. He was part of that. And later on, he went to England, and it was Howard Florey and Ernst Chain in 1940 who did the mass production of penicillin. And 1940 was the time when Second World War was happening, and discovery of penicillin at that point of time helped save many lives because of mass production of penicillin at that point of time by Howard Florey, who was in UK at that point of time. So that's his contribution. So when you talk about penicillin, which dramatically changed the paradigm of saving lives in sepsis, it was because of Alexander Fleming and Howard Florey, who was from Adelaide, and Ernst Chain in 1940. So these are the recent additions to sepsis, very important people. So these stamps were issued by Sweden in 1996, and they won 1982 Nobel Prize Medicine, Nobel Prize winners for physiology and medicine, Soon Bergstrom and Berg Samuelson. So they were Swedish guys. They discovered lipid mediators of sepsis, where they identified this pathway where phospholipids are converted to arachidonic acid and platelet activating factor, but phospholipase A2. And these they go through lipoxygenase and cyclooxygenase pathway to produce all the cytokines like leukotrienes, prostaglandins, and thromboxanes, which are all the mediators of sepsis. These mediators of sepsis from this pathway, from the phospholipid mediators of sepsis, was discovered by these two guys, and who were awarded the 1982 Nobel Prize. So this was the most recent contribution in sepsis commemorated on philately or on the postal stamp. So friends, as you see, you can learn a lot about history of sepsis through a window of a small little stamp, which I'm an expert in. So that's about it, friends. So that's the historical tidbit on how sepsis evolved over the last 150 years and who are the pioneers who contributed to our current understanding of sepsis. So thank you, friends. Request you all to submit your valuable work to Journal of Acute Care. You can visit my website to be here to discuss it. Thank you. Thank you, one and all. And let us all join hands to raise the awareness and campaign against this sepsis. Thank you, friends.